Welcome to Blooming Out, a locally produced public affairs program discussing the issues and events affecting the gay, lesbian, bisexual, and transgender community of South Central Indiana. Blooming Out is written and produced by a team of dedicated volunteers and financially supported by listeners like you.
Well, Emily Brinegar is the prevention coordinator at Bloomington Hospital's Positive Link, and she is back in the studio with us to talk about the HIV/AIDS crisis.
Welcome back to the studio, Emily.
Thank you. Thank you very much for having me.
It's great to see you. Just briefly tell our listeners a little bit about yourself and what you do at Positive Link.
As you said, I'm the prevention coordinator at Bloomington Hospital Positive Link. We are South Central Indiana's regional HIV/AIDS client services and education and HIV testing site. We do education and outreach around HIV and other STDs. We also do HIV, syphilis, and hepatitis B and C testing in our office and at the Monroe County Health Department Futures Family Planning Clinic. In addition to our prevention outreach that we do, we also have client services, which case managers who work with people who are HIV positive to help them get the resources that they need and to live longer, healthier lives.
Are all these services free or low
They
cost?
are. We do always have a free HIV testing option. Currently, that option sometimes is a rapid test and sometimes is not. And I know that that's a little wishy-washy of an answer, but it depends a lot on our funding. But yes, all of our client services are free, and we always do have a free HIV, syphilis, and hepatitis testing.
Does your funding come from local groups, national groups, state groups?
Most of our funding comes from the Indiana State Department of Health, which administers Ryan White Care Act money through the federal government.
Well, you know, I know it probably local people, if they read the local newspaper today, probably saw the report on the increase in STDs among young people, which is very alarming, and HIV infection continues to creep up. I read an article today that said that HIV infections, for instance, among black, gay, and bisexual men has increased by 80% across the country. That's alarming. This all really terrifies me, and what do we do to stop it?
What do we do to stop it? That's a very good question. I think that we'll really see some changes in the near future in the way prevention funding is used and the types of prevention programs that are funded. Clearly, what we've been doing for the past several years isn't working out very well, and I think there are a lot of issues that play into that. Certainly one being coming through a really conservative administration, and hopefully that will change. I feel like the programming is going to be a little bit more progressive in that really targeting specific populations, minority populations, or making the programming very user-friendly and specific to the people that the information needs to get to, and maybe not in the general, really traditional, what we've seen so far of just really preaching a lot of condom use or abstinence, and looking into more things like community mobilization and self-esteem issues and general healthy living types of things that are going to give people the resources and the tools they need to live healthier lives in general.
I suspect it's more difficult for people who are in the county to come in and get these tests done. Do you go out to different places and do testing there, or is it all done here in Bloomington?
We do go to some of the surrounding counties. Currently we go to the Lawrence County Health Department, the Greene County Health Department, Dr. Allward's office in Nashville in Brown County. Those are some of our health department testing that we do. In addition, a lot of our funding right now comes for specifically testing people in substance abuse treatment. So we do go to several programs in other counties that have substance abuse treatment facilities and do a lot of education and testing there.
Do you think we're reaching people adequately?
we can always reach more. There's always a need. In the past year, just between 2006 and 2007, we doubled the amount of outreach, education, and testing that we've done through Positive Link, which is really exciting to me. And I think we'll continue to see that growth. I hope that we do.
Well, you mentioned briefly that we're coming through this very conservative political climate in our country, and clearly that has been a real negative effect, I think, in people's self-image. And obviously abstinence doesn't work,
Right?
and program funding has been cut. What have you been doing? Do you have support groups? What kinds of things have you been doing to try to advertise that you're there? I mean, and people hear about you, and you know, kind of how do you drag them in? You know, for instance, AA. People are sent to AA a lot of times because of the court system or because of family counseling and
Right.
things like that. There is nothing that is going to drag somebody in because they may have HIV/AIDS, or to find out if they do.
Absolutely. I really think word of mouth is our strongest promotion. We do, we have posters up in the community. We try to go through channels as far as listservs, that kind of thing, and just working within the community. But we actually ask when anybody comes in for an HIV test, how did you hear about us? And resoundingly, the majority of times it's from a friend.